Today, we're going to simplify Medicare breaking down Parts A, B, C, and D, plus Medigap, also known as Medicare Supplement Insurance. Let's start with Part A, your hospital coverage. Part A helps cover inpatient hospital stays, short-term skilled nursing care, hospice, and some home health services. Most people don't pay a premium for Part A because they or their spouse worked and paid Medicare taxes for at least 10 years. Think of it as hospital insurance you already paid into through payroll deductions over time. Part B is your medical coverage. This includes doctor visits, outpatient services, lab work, imaging like X-rays or MRIs, durable medical equipment, and preventive care such as screenings or flu shots. Part B does have a monthly premium of $202.90 per month in 2026, and higher income earners may pay more under the IRA adjustment. Together, Parts A and B make up Original Medicare. That's your foundation. But there are still deductibles, copays, and coinsurance that aren't fully covered, and that's where the next options come in. Part C, or Medicare Advantage, is an alternative to Original Medicare. These plans are offered by private insurance companies approved by Medicare. They bundle your hospital, medical, and usually prescription drug coverage all into one plan. Many Advantage plans include extra benefits like dental, vision, hearing, transportation, and fitness programs. The key thing to remember is that these plans have provider networks, so clients need to confirm their doctors and hospitals are in-network before enrolling. Part D is prescription drug coverage. It helps pay for medications filled at the pharmacy. Each plan is offered by a private insurer and can differ in which drugs are covered, how much they cost, and which pharmacies you can use. When helping clients choose a plan, review their prescriptions carefully to make sure their medications are on the plan's formulary. Now let's talk about Medigap, or Medicare Supplement Insurance. These policies are sold by private insurance companies and are designed to work only with Original Medicare, not with Medicare Advantage. When Medicare pays first, a Medigap plan helps cover what's left over, things like deductibles, copayments, and coinsurance. Some Medigap plans may even help cover medical care outside the U.S., like emergency care when traveling abroad. Depending on where you live and when you became eligible for Medicare, you may have up to 10 standardized Medigap plans to choose from, labeled Plans A, B, C, D, F, G, K, L, M. And N. Each plan offers a different set of standardized benefits, and a Plan G is the same no matter which company sells it. The only difference is the premium. Now here's an important rule. If you became Medicare eligible on or after January 1st, 2020, you can't buy a Medigap plan that pays the Part B deductible that means. Plans C and F are no longer available to new enrollees. However, if you qualified for Medicare before that date, you can still apply for Plan C or Plan F. And remember, Medigap only works with Original Medicare. If a client is enrolled in a Medicare Advantage plan, they cannot purchase or use a Medigap policy. Let's take a quick look at how these options differ. Original Medicare covers hospital and medical services and allows you to see any doctor or hospital that accepts Medicare. But it doesn't cover everything. You'll still pay out of pocket for some costs. Medigap works with Original Medicare to cover those leftover costs like deductibles and copays. It doesn't include drug coverage, but it gives you freedom to see any provider nationwide with no network restrictions. Medicare Advantage, or Part C, combines hospital, medical, and usually prescription drug coverage in one plan. It often includes extra benefits like dental or vision, but you'll need to stay within the plan's network for the best cost. In short, Original Medicare gives flexibility, Medigap fills in the gaps, and Medicare Advantage bundles coverage with added benefits. To wrap up, here's what you should remember. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage, an all-in-one option through private insurers. Part D covers prescription drugs, and Medigap supplements Original. Medicare to reduce out-of-pocket costs. When you understand how these pieces connect, explaining Medicare becomes easy and helping clients make informed, confident decisions becomes second nature.